The World Health Organization Africa is briefing the media on COVID-19 vaccine rollouts and the Omicron variant in Africa. Let's take you live to that.
To answer your questions, this includes Dr. Tiano Balde, who is the incident manager for COVID-19 response here at the regional office. And we also have Dr. Nisi Gumede, who is our regional virologist. So before we get additional questions, I would like to ask a question that was sent written. Please indicate if you would like to go live. So I start with this question. This question is coming to you, Dr. Tiano Balde. What do the latest figures and study in South Africa tell us about the severity of the Omicron variant? And how many of them are vaccinated and how many are unvaccinated? And Dr. Nixie, you will answer the second part of the question. If the Omicron had proven to have a higher transmissibility than Delta variant, but will cause milder disease, is it good news for the world? And is it a way of the world to exit the pandemic? Okay, Dr. Tiano, you answer the two questions, please.
Okay, thank you so much, Dr. Mary, and good morning, colleagues. I mean, we are really monitoring very closely the situation which is happening currently in South Africa over the past 3 weeks. And I can tell you over the past 7 days that we are seeing definitely a kind of major increase in the number of cases. Almost a 255% of increase during the past 7 days in terms of the number of cases. And in terms of admissions in both public and also private hospitals, we are seeing also an increase in number of cases. And this is about almost 12% of increase when we look at the past 24 hours. That was as of yesterday. So definitely we are having more cases and also more people who have been admitted in the hospitals. But as Dr. Richard rightly mentioned, I mean, when we compare the situation of now with the Omicron in comparison to the Delta, definitely the number of admissions are quite very low. So, but also it's very important to mention we are really at the beginning, at the onset of this current fourth wave. So we might need to have a little bit more time. So just to go also more in details around, I mean, the hospitalization, when we see, I mean, the impact of the COVID-19 patient into the ICU capacities, which is quite a very important indicators. We have seen that currently in South Africa, only 6% of the ICU beds are currently occupied by COVID-19 patients. So there is still a kind of good margin within the health system, I mean, in South Africa, and especially in the Gauteng province, I mean, for really addressing those current and the changing needs. In terms of vaccination, I think it's quite early also to, because we know that we have very limited data. We have really very preliminary information around, I mean, all of the patients who has been admitted. Most of them were quite younger people, and so probably also with a kind of a variability within, I mean, the vaccine status. But at the meantime, it's quite very important again to mention that we might need additional weeks to see exactly, you know, the impact of the Omicron on the severity of the the severity on this disease. And the other point about, I think, how can we feel about this from South Africa? Again, let's do not be over optimistic. I mean, we have to monitor the situation and to be, I mean, driven by the facts, by the figures, by the information that we are receiving both from South Africa, but also from other neighboring countries also, where we know that the Omicron is circulating. Back to you, Mary. Thank you.
Thank you very much, Dr. Balde. Paul, I understand you would like to go live with your question. If you're ready, please go ahead. 1 to 2 questions only, please.
Yes, thank you very much. So my first question is for Dr. Migo regarding the issue of unused vaccines, especially in countries that have very wide margins, that are only using less than 10% of the total vaccines that they've used. So can we have an indication of how many doses have expired because these countries were not able to use it, and whether there is a new policy regarding the expiration date for those donation for donated vaccines for African countries to receive? And for Professor Api, I'd like to ask your thoughts regarding the capabilities of Africa's genomic surveillance ecosystem. What is the proportion of total samples collected that is required to be sequenced to have a clearer picture of what is happening? Because we have countries that, I think less than 5 countries in Africa have been able to provide sequences for samples that were collected in the last 15 days. So I want to know what needs to be done to quickly close this gap so that we can have a truer and more real-time picture of the situation regarding genomic surveillance. Thank you very much.
Okay, thank you, Paul. We start with you, Dr. Richard, and then Prof can come in with the question on the sequencing.
Yeah, thank you, Dr. Mary, and thanks, Paul, for this question. In general, when we looked at the supplies that have arrived on the African continent, I think particularly the last 4 to 6 weeks, we have seen an increased number of doses that have arrived. We have moved to a situation where we're receiving 2 to 3 million doses per week, towards a situation where we're receiving around 20 million doses per week. So when we're analyzing the data during this 4 to 6 weeks, in general, we have had between 60 to 80% of the doses that have arrived and that have been used. But cumulatively, when we looked at the data from all the 54 countries in the region, we have only, I think, 2 countries that are really very much lagging behind, less than 10% of their doses that they've been using so far. The vast majority of the country, more than half of the country, have used between 50 and more than 100% of the vaccine that they've received so far. Again, we need to take into consideration the increased number of doses that have been received, particularly the last 3 to 4 weeks. This is bringing the majority of the country now between the other part between 50 and 40% and 30%. Now, in terms of the policy in using vaccine, we have issued a joint statement between WHO, UNICEF, Africa CDC, we as part of the COVAX, reiterating the needs for the donation to be for at least a very long period of time. We have seen the issues that have been created by the vaccines that are coming with a very short shelf lives, which tend to create or pose additional challenges to the country when it comes for the rollout of these vaccines. So we are, however, very much encouraged by the trends that we are now starting to see where the uptake of the vaccine, particularly during this Omicron period, many countries are really ramping up their vaccination drive. And those who are lagging behind, as I said in my introductory remarks, we are really focusing on them to make sure that they can support not only WHO, but also working with all the partners to make sure that we can provide targeted support to those countries.
Thank you very much, Dr. Richard. Professor Happy?
Yes, I just want to say that the question was to find out the capacity of Africa in terms of sequencing, the genomes. I want to say that the capacity, although not consistent in all countries, but it's very robust. You could see our colleagues in South Africa being on top and discovering this variant. And also to state that even within Nigeria and then most West African countries, there are several hubs of excellence in Ghana, in Senegal, and other places. What is beautiful about what is happening during this pandemic is that the strong cooperation among African countries, and we are collaborating and we are supporting other African countries. Now, you mentioned the fact that while we only about a few handful of countries in Africa, have generated, updated sequence data. The truth of the matter is that you cannot generate the data that you don't have, in the sense that recently, in the case of Nigeria, we have been consistently sequencing, and most cases, they were negative even PCR tests in many states. We got to a very low level, and then now we started having this case. the few cases, and now we're actually also looking into it. You cannot just fabricate data. You have to generate. You have to show the data that you are producing. And if the data are coming out, and then we can show that we have Omicron or we have other variant, we will share. The truth is the fact that around August, September. My lab is one of the lab testing in Nigeria. The number of cases, the number of positive cases from sample received were very, very low. And as such, you can produce genome from negative cases. Now that we have this, we're going to work, and then we're definitely going to be sharing the data as we generate them.
Thank you, Professor Happy. Nixie, do you want to weigh in on strengthening the capacity for sequencing in the region?
Yeah, thank you so much, Mary. I don't want to take more time on this because Prof. Happy has just very well elaborated on the situation in Africa. So if we look at what it was before, like towards the end of 2020, we had quite a handful of countries or laboratories that were managing to produce the sequencing data. Today, the countries that are having their own sequencing data, they are close to 50. So it shows that there is quite a very robust system that has been really initiated by Africa. And remember that at the beginning of the pandemic last year, Africa CDC, together with World Health Organization, they came together to collaborate and form a very strong network for COVID sequencing laboratory. Prof. Happy is one of our specialized referencing laboratory that are supporting the lab. As he was mentioning earlier on, that he's busy training some of the countries. So with that, we can really say that the number of cases or number of sequencing data that was produced by the end of 2020, they were close to 4,000. As we are speaking to you now, I think the entire region is producing close to 70,000 sequencing data that has been reported into one of the platforms that are publicly published globally. So that is an indication that really the region is upping the scaling of the sequencing in a very aggressive way to support what is happening currently. Thank you, Mary.
Thank you very much, Dr. Nixie. And this question is coming to you, Dr. Richard. The question is coming from Aena from Reuters. The Serum Institute appears to be cutting vaccine outputs because of slowing demand from COVAX. Are there adequate flows to COVAX? Are the shots from Serum now being replaced by donation? And then the second part of the question is, what is being done to help countries overcome the challenges of deploying the shots? Given the level of uptake, at what point would you recommend vaccine mandates? What is the alternative to a mandate?
Okay, thank you, Dr. Mary. These are quite a very good question. On the first question on the Serum Institute of India, maybe we need to clarify things here and put the facts into perspective. You remember that after the occurrence of the Delta variant in April, May this year, the Serum Institute of India suspended all the export of vaccines to COVAX, but also broadly, which created a lot of course, issues in this region, particularly that many countries were expecting to receive the vaccine through the COVAX mechanism, and some countries even left without having provision of a second dose. So the reality is that in the first place, the supply was stopped by the Serum Institute of India at that time. So more recently, or indeed, we heard the good announcement of a restart of these exportation. But as we know, the issue is not necessarily COVAX alone. I think in the meantime, countries move on, looked for alternative to find their solution, to get a bit more supply. And if we looked at the current pipeline in the COVAX forecasts, I think the pipeline is quite very promising. We are expecting to receive between 800 million to almost 1 billion doses through COVAX. And this number is going probably to double next year. So the issue today is not the lack of demand through COVAX. I think we have now enough product, enough vaccines that are going to come through the COVAX mechanism. So what we need to do really now is probably the second part of the question, the challenge in deploying these vaccines. And I think, as I've said before, we are doing whatever it takes, not only WHO, but also many other partners, working with our colleague at Africa CDC, working with UNICEF and countries themselves to see how the bottlenecks that are hampering the delivering of the vaccine can be really resolved. So we've deployed different surge mission in countries that are lagging behind to try really to pinpoint all the small issues that our country are facing. So we do hope that we are going to get to a situation where countries are going to accelerate their pace in terms of vaccine deployment. And then finally, on the issue of vaccine mandates, I think WHO has been very clear on this since the beginning. I think one of the priority was, first of all, to make sure that there is enough supply, there is enough vaccine to make sure that everybody who needs a vaccine can get a vaccination. So the issue was not only to get the supply right, but also to increase the vaccination opportunities. Because sometimes, even if the vaccine are present in a country, getting them through the delivery system in the country, we're creating a problem. So I think we believe that the first step to do is to make sure that we need to have the vaccine. We need to increase the vaccination opportunities. And then the country can now balance these type of measure, starting by this incentive to get people get vaccinated, but also a good explanation on the benefit of vaccination, and then ultimately to move towards some of these coercive measures. But really, we are advocating more on this comprehensive approach to get as many people as possible there to vaccination before getting to such mandatory sort of approach.
Thank you, Dr. Richard. Leon from Daily Nation, are you ready to ask your question?
Hello. My name is Leon Lidigu from Daily Nation in Nairobi. Now, I have a number of questions. Now, the first one is Canada this week announced that it wants the Southern African countries to do PCR tests in third-party countries like Kenya, for example, before being allowed to travel to those countries. So I want to know what is WHO's position on this, considering that these countries are also struggling to test people and do genomic sequencing due to the Omicron variant at the airports. And then WHO also contested this. And then my second question concerns Pfizer. Now, Western media and even Pfizer itself reports that now 4 doses of Pfizer will be needed to deal with the Omicron variant. How will this affect our drive as a continent, considering the fact that President Biden, Dr. Fauci, and other key figures are actually pushing for that? And if you remember, Dr. Tedros placed a moratorium on boosters. So what happens to also those who have already received the 2 doses? Will the WHO be joining the boosters bandwagon, considering the fact that now Pfizer is announcing that we actually need 4 doses? And then finally, Juba in July donated 72,000 AstraZeneca doses to Kenya because it couldn't execute a rollout of the jabs. And then we saw the European Union provide funding to UNICEF to strengthen the rollout in Southern Sudan. But according to WHO, what is the current situation there? Thank you.
All right, we're going to come out of that WHO Africa briefing and head to a quick break.